Hello there, my name is Matthew Garcia and this is my video checkup for urinary catheter for a female. So I'll go ahead and start by verifying the order of the healthcare provider. So I have the paper chart here. I see that Anna Pawlowski has an indwelling catheter insertion order, so I'll verify that. So I'll go ahead and introduce myself. Hello there, my name is Matt. I'll be your nurse for today. I have your name and date of birth. So I have Anna Pawlowski, date of birth is May 5th, 1957, so verify computer. Do you have any allergies to know about? Penicillin? Okay, what is reaction? Hives? Okay, verify wristband, verify computer. Okay, once I have that, I'll go ahead and state what I'm here for. So, I'm here to do a urinary catheter insertion. Is that okay? Yes, awesome. Now I'll go ahead and make sure bed is safe, provide privacy, bed low is height, side rails are up. Say call out within reach. Okay, now I'd go ahead and ask before we begin. I would like to know if you had any problems with a urinary catheter insertion before or urethral stricture before, if you ever had that. No? Okay, awesome, so that's perfect. So go ahead and perform hand hygiene. Now I'll go ahead and apply clean gloves. And I've already gathered all my appropriate materials, so it's all good. I'll go ahead and apply my clean gloves. And I'm gonna go ahead and first raise the bed to a working height, put the side rails down. Now go ahead and drape the patient's upper body, providing privacy. Now I'll go ahead and place the patient in the dorsal recumbent position. So knees slightly flexed, legs spread out, knees slightly flexed. So I have the patient in a dorsal recumbent position. So I would go ahead and first thing I would do is perform perineal care. So I would have the hospital approved cleaning supplies, and I would clean it first. And I would go ahead and examine the perineal area, and I would go ahead and locate the urethral medius. So I've located the opening is right here. So once I've located the opening, I'll go ahead and take off my gloves. Go ahead and sanitize my hands. After I'm done sanitizing my hands, I'll go ahead and grab my urinary catheter bag. Go ahead and open it up. Now I would use this outer plastic bag as a trash bin. Place it here. And I would open this up touching the corners only. So being very careful, touching only the corners, one at a time. Okay, so once I've opened it, I'll go ahead and grab this part by this corner, open it up. Make sure touching the corners only again. I'll go ahead and lay this drape down. Okay, and then I'll go ahead and take my gloves. Before I apply it, I'll do proper hand hygiene before applying my sterile gloves. Go ahead and take them out. After I apply my sterile gloves, I'll go ahead and discard this in the trash. Now I'll go ahead and take the fenestrated drape. And I'll go ahead and put it over here, exposing it. Okay, perfect. So once I have that exposed, I'm gonna go ahead and first I would make sure that the tube is clamped. So as you see, it's clamped. I'll go ahead and open up the lubricating jelly and I would pour it out on the tray. So start with that. I'll take the antiseptic solution, pour all over the cotton balls, and then discard it. Then I'd go ahead and remove the plastic covering of this, slowly making sure it doesn't flop. So I have that, discard that. Now I would place this in the lubricating jelly. Let it sit there. And I would take my syringe and I would go ahead and stick it in the bifurcation. Once I have it placed in there, first thing I'm going to do is get my non-dominant hand. I'll separate the labia, and now this hand is contaminated. Now, take my dominant hand and take the cotton balls down, I'll clean the area. So I'll clean the dorsal side first from top to bottom. So from top to bottom, discard of it. Now from the nearest side, from top to bottom, discard. Now going straight down the middle, from top to bottom, now discard of it. Now go ahead, take the tube and grab it about 3 to 4 inches away from it, and I would go ahead and ask the patient, could you bear down for me as if you're voiding? So bear down for me, and then I'll insert it. And once I see urine coming out, okay, I'll insert it for another 1 to 2 inches. So I have that in there. Now I would take my dominant hand and I would slowly inject 10 milliliters of liquid. I'll go ahead and gently remove this card. I'd go ahead and check to see. Okay, so I see that it's not moving, so that it is anchored in place. And I would go ahead and tape this down to the inner thigh. I have my tape. I'll tape it just above the bifurcation, just right on the upper thigh here, okay? I would go ahead and get my bag, and I would hang it on the side of the bed, making sure it's lower than the bladder. So I'd hang it here on the side of the bed, making sure it's lower than the bladder. Okay, so once I've done all of that, I would go ahead and provide perineal care as needed. I would go ahead and I would discard all of the equipment. After I'm done discarding all the equipment, I'll take off my gloves. Sanitize my hands. And then I would ensure to drape the patient again. Go ahead and make sure they're comfortable in position, put the drapes over, make sure they're comfortable. I would go ahead and document the urine and output. So I'd go ahead and document the amount of urine, the consistency or color. So the amount, the color of the urine, the clarity of the urine, the amount of water that was in the balloon, and the size of the catheter. So once I've documented all that, provide privacy, make sure the patient's okay, I'd go ahead and make sure they're safe, open up the curtains, and perform hand hygiene. I'm all good to go, and that would conclude my checkup. Thank you.